We have a close-knit group of specialists and generalists that are always in our program. It's a group effort. It's like a small group practice where we have specialists. It's unique in the system of GPRs. All the things that go on in the hospital we treat there too, but the uniqueness of the program is in our attendings and how we treat patients.
This is one of the programs where it's bread and butter dentistry, as well as you do a lot of your own specialty procedures. Last week I did a surgical extraction the same day I did crown lengthening surgery. It's so funny. It's all the facets of dentistry at once, and I think that's one of the main strengths.
So it's been great. We have 3 rotations that we do at the main hospital. We had anesthesia, we had emergency medicine, and internal medicine. So that was a great experience coming from a dental school where we weren't really able to treat emergency patients. So coming in here, we kind of just dived into everything. Being in the emergency room with all the physicians is just a great experience. And just being able to know how to treat and manage patients as they come through your practice is a huge, benefit of this program, I think.
I mean, the thing that makes us unique in the hospital is the technology we have. The hospital's been great getting me all the technology we need. Some of the stuff we do isn't just scanning we do scanning, which is difficult to learn. The future in dentistry is scanning and technology, digital dentistry. We have everything we need.
CEREC is one of the big things coming into dentistry. So digital scanning, digital milling. We have that software, we use it, and in dental school I had limited experience. Here we use it fairly often. So after a little bit, after you kind of get that initial introduction, we do a lot more with that, and now it's up to us. So we treatment plan our patients with that software. We also use our panoramic machine, cone beam CT, imaging for implant planning. So we really try to integrate all of the big technologies into our treatment planning and the best treatment for our patients, which is nice.
The faculty is probably the strongest part of this program. Just having someone there to bounce ideas off of or to talk with if you have a challenging case. And they really are very perceptive to understanding your strengths and weaknesses. They work with you and alongside you. You're not necessarily below them. They treat you more as a colleague versus as a student, which is nice here. I think that's one of the strengths.
You do feel like you have the autonomy to be your own provider, which I think is important, coming from dental school to private practice and my next step. So I would say this was probably the best, in-between transition that I could have asked for. So,
small program, we do a lot. Depends on what the residents are here for. Like our program is geared towards general dentistry, hospital dentistry, so you walk out, you're able to be a private practitioner or work for FQHC or something, be able to take your patients in the OR in the hospital.
Here I think I've learned more in the past couple of months than the years of dental school. They're definitely a great foundation, but you're really given a chance to run here, so it's great.
And leaving here, just the confidence that you have to know that you can do that and you're going to treat them the best way that you can, it's empowering. And that's, I think, the biggest thing that you leave this program with.